Family and friends of people with severe mental illness often act as informal carers, helping them with emotional and practical support. This support helps to improve patients' quality of life, facilitate their recovery, and reduces mental health crises and hospitalization.
So the role of a carer is very important because nobody knows the service user better than a carer does. A carer knows what makes them tick, they know what their habits are, they know what their personality traits are, and they also know what signs to look out for when they're ill.
Carer involvement in healthcare has solid research evidence. However, service evaluation data suggests that often carers are not involved in routine care decisions, and even less so when patients are hospitalized. We know that hospital admission is a very stressful and emotional period for both patients and their carers. Therefore, it is particularly important to develop a shared care plan early on during admission so that both receive the appropriate support.
A carer can shed light on things that might have been missed by clinicians when coming to a diagnosis or when devising a treatment plan.
Our research team at Queen Mary University of London co-developed, together with service users, carers and NHS clinicians, a training program and a manual in order to help clinicians to involve carers early on in mental health treatment when patients are hospitalized. This training focuses on how to arrange and how to facilitate a session with patients and carers within 1 week of admission.
The training took just an afternoon. We had the chance to discuss the procedures both with academic and service users and their carers. Then I delivered the session to individual patients who were admitted to my ward and their carers. My patient appreciated that the session was led by their individual needs and provided the room for discussing concerns away from the more intimidating ward round.
Within inpatient wards of a mental health trust in London, we showed it was feasible to involve carers within 7 days of the patient's admission in more than half of the patients. Patients reported an improved experience of care, which was linked to higher engagement with care after hospitalization.
The carers were positively impressed and they said that they never had the chance before to experience such attention to their perspectives and input.
We have now developed and will be testing an e-learning module based on the training. This in order to spread this innovation across England. Our short and online accessible training can help to make sure that all members of the inpatient teams are confident with carer involvement. Carer involvement can then be always available to all patients and become part of the working culture of a ward. This is crucial for its implementation in practice. Help us disseminate the intervention across the NHS so that carer involvement can become a reality for all patients in England.